Hello, dear colleagues. In this presentation, I will talk about our experience in the functional relevance of diffusion tensor imaging in patients with cervical myelopathy. This is our first paper about this topic published 4 years ago. There are two main points that we have to keep in mind about DTI. The first one is the fractional anisotropy. This parameter measures the tendency of water to spread in a preferred direction within a group of axons. Then, it is a function of the axonal density and integrity of white matter fibers. A decrease of fractional anisotropy, Fa, corresponds to a damage of tracts. ADC, apparent diffusion coefficient, measures the diffusion of water molecules in 3 dimensions. In other terms, an increase of ADC indicates a damage. It is the opposite of the fractional anisotropy. In this slide, you may see the behavior of these two parameters in a current scale. On the right, when we have a passage of Fa from red to green and blue, we have a decrease of fractional anisotropy and a damage of the spine, the spinal cord. On the left, it is through the opposite, an increase, that is, a passage from blue to red, means that there is a damage of the cord. Also, this slide shows the correlation between the imaging of the MRI and the diffusion tensor imaging, the tractography. In the first line, you have a normal cord that corresponds to a red cord. And in line D or E, you have a serious compression of the cord that corresponds to a green or blue cord. Here we have the same concept in terms of ADC and in terms of Fa, with correlation with the image of an MRI. You may see that where we have an hyperintensity signal within the cord, red row, we have a color green. That means damage, both in ADC sequences as well as in Fa sequences. This is a surgical case before and after surgery, and you may see that we have a passage in the inferior half of the image on the red side, a passage from blue color to yellow and red color. That means a decompression and improvement of the cord. In this slide, we have a graphic representation of the parameters we have considered, ADC, Fa, and also radial diffusivity, before and after surgery. And you may see that there is an improvement in terms of Fa as well as ADC. We have looked for a correlation between this clinical sign, mielopathic hand or clumsy hand, and these findings in MRI images. You know that in a patient with a serious damage of the spine at cervical level, we may have a serious damage of the dexterity and the strength of the hand, as you may observe in these photos. And then we have investigated this possible correlation and its prognostic relevance. We have analyzed the functionality of the hand in this way. The test you may see on the left, that is a test of dexterity of the hand and strength in grip and release of the strength with a dynamometer. And here we have reported the results of this test. And it is interesting to observe that there is a different result in right and in left hand in terms of improvement of dexterity, hold peg test, and we have a similar improvement in terms of strength of the hand, and this improvement is evident not immediately after surgery, but after some months post-operatively. Another test is a test that analyzes the kind of movements that the patients may realize with a sensorized glove. In this case, the patient have the task to grip, to grasp a different object of different sizes, like here. And this is the result after surgery in terms of this test. This is another surgical case before and after surgery in terms of MRI control and in terms of DTI control. And here you may observe an enlargement of the previous images with a clear improvement in terms of fractional anisotropy. That means that probably there is an improvement in terms of a microstructure of the cord at the compressed level after surgery. This is an interesting finding because we have observed that the main improvement in terms of FA is observed not at the level of the compression or at the most compressed level, but below. In terms of FA, we have an improvement below the level of main compression. This is our last paper on this issue, published a few months ago, and our conclusion, you may read here, is that when we talk about cervical mielopathy, we talk about a really highly complex clinical situation. So in the diagnosis as well as in prognostic evaluation, you have to keep in mind the history of the patient, imaging, neurological status, and the introduction of DTI sequences, allow detecting the spinal cord damage even in the early myelopathy stages compared to the two-weighted MRI features. The combination of these different methods of imaging and diagnostic regarding the clumsy end can help to accurately select the patient to be treated surgically, and may also provide us promising details in terms of predicting of the outcome. In conclusion, DTI sequences, measurement of fractional anisotropy and ACD, but also many other parameters, allows us to get a better understanding of core structural damage. The compression improves values and color maps of FA and ADC. This improvement is associated to clinical recovery. Analysis of hand performances is well correlated with improvement of FA and ACD and is a reliable prognostic marker. Thank you very much for your attention.